One of the most important factors we know in general reproduction, but also when we start looking at this specific question, is patient age. We start seeing decreases in pregnancy rate and possible advantages with something like IVF over tubal reversal after about the age of 35, 36. And so patient age is probably one of the most important factors. The other thing that we like to do in anyone that comes in for this type of evaluation is make sure there isn't any other barrier to conceiving. So fertility testing on the person undergoing the tubal reversal, but also on their partner, to make sure that we don't put them through a surgery that may not be effective for them. So that's really important. Probably the other thing that's most important is what type of surgery have they had for their tubal surgery. Is it something that would allow us to get the appropriate size of tube that we need to make that successful for them? One of the biggest things that we want patients to consider before they come in for evaluation is what their reproductive goals are. How many children do they foresee them having or that they desire to have, and whether or not there exists any restrictions as far as treatment from a religious perspective, from a cultural perspective, any limitations that we need to consider or work around. The other big thing is only some states now cover or have mandated coverage for something like IVF, but some insurers cover tubal reversal over something like IVF. So if there is coverage there from an insurance perspective, that can be really helpful in maybe assessing which one makes the most sense. The other things we like you to consider are getting records for previous tubal surgeries that you've had so that we can have an idea of what's available for treatment. The other thing is, what does recovery look like? Recovery for the procedure that we do here, you're looking at about 2 to 4 weeks for a tubal reversal recovery, and so that may be time off of work or something like that. Whereas something like IVF, while it can be time intensive, it's less recovery intensive. Usually recovery after our procedures is maybe 1 to 2 days or so. So when we look at the data surrounding everyone, all comers, when it comes to tubal reversal, people of a wide range of ages, we're looking at a success rate of probably 65 to 68% over about a 2-year time period. That 2-year time period seems to be when we hit sort of the maximum success rate after a tubal reversal surgery. When we start looking at the average success rate for the patient that comes in and we average that over, say, 2 to 3 IVF cycles, we're looking at about a 65 to 70% chance of pregnancy with those 2 cycles. So as you can see, the similarity is there as far as success rate. It's just one is a little bit more time effective, and that can play a really important role depending on patient age. That's one of the major considerations when we start looking at tubal reversal versus something like IVF, is the possibility of ectopic pregnancies after. We know that we can try and repair the tube as best we can, but it will never go back to the way that it was fully functioning. There will always be some level of dysfunction in the tube. So much so that we're looking at an ectopic pregnancy rate after tubal reversal of about 4 to 8%, as opposed to about 1 to 2% with IVF. And so in someone that does go through tubal reversal, being very aware of your attempts at pregnancy and seeking care early on in pregnancy is very important to make sure that we don't have something like an ectopic pregnancy that is formed. Every institution and location has a different price. For access to a surgery center, the time involved to do those things. On average here at our clinic, you're looking at probably close to about $30,000 on average for a tubal reversal. The advantage to that is if you're looking at multiple children, you can space that cost out and it may make sense overall. When we look at something like IVF, on average, you're looking at maybe a $10,000 to $12,000 cost per IVF cycle. So if you look at that cost ratio, you can get about 2 to 3 IVF cycles for the cost of a single tubal reversal, which can sometimes make a lot more sense for the person that wants to have just one child as opposed to multiple children, because the person that undergoes the tubal reversal will need to think about whether or not they want their tubes tied again after they're done conceiving, or if they want to go on some sort of birth control or prevent pregnancy. And so a lot of it is a balance between the two, but right now tubal reversal surgery is fairly expensive when you compare it to IVF and the success rates that we have.